Great. I'm going to talk about health policy and budget policy, or health policy is budget policy, and budget policy is health policy. Let's talk about Medicare now a little bit. About $600 billion, just chump change, right? It's a federal program. Okay, you're surprised the number of people in the country, members of Congress who don't understand that. It's for the elderly and disabled. Elderly, disabled federal program. It's got 4 parts. Part A is hospital care plus some stuff. Part B is outpatient care plus some stuff. Those were the original parts of Medicare in 1965, 66. Part C was added, I think around 1980 something, 85, 86, 88, something like that. That's basically managed care. It's gone through a number of different names. It's now called Medicare Advantage, or MA, and that's basically A plus B. In 2006, Part D was added, a prescription drug benefit. So before 2006, pills you would buy at the pharmacy, Medicare didn't pay for. People had supplemental insurance for that. And then if there's a Medicare Advantage managed care plan that also provides prescription drugs, that's called an MAPDP. It's Part C plus Part D. Medicare is about 22% of all healthcare spending, about 60% of the federal health spending, 30% of mandatory spending. Part A, again, think of that as hospitals. Part B, think of that as outpatient doctors and similar things. They're about equal at about $260 billion. But Part A, but most of it comes from payroll taxes. So when you get your paycheck, they used to just call it FICA. Now they split it out and you see that Medicare dollar amount. That's what's going to pay for the hospital Part A. You're paying for Medicare enrollees' hospital payments. It's also where the trust fund comes in. So when we talk about the trust fund going broke, that's Part A. Part B is 3/4 general revenues and 1/4 premiums. Part D, which is about $80 billion, is similar to Part B, but it's 3/4 general revenue, and then it's a little bit of premiums and a little bit of state dollars, because some of those people are on Medicare and Medicaid. So the people on Medicaid, this is where the state dollars come in. Hospital services for Medicare is about 1/4. Medicare Advantage is about 1/4. Physician payments is about 12%. Drugs are about 11%. And then the rest of these things are split between A and B. The reason I actually want to talk about this briefly is if you want to save money, you're working for a member of Congress or some advocacy group and you're trying to find savings in Medicare, where do you go? You go to the biggest piece of the pie. Right? If you're worried about the trust fund, where do you go? Which part of this pie do you go to if you're worried about extending the life of the trust fund?
Hospital.
This part of the pie. You can also go to Medicare Advantage, because that's A plus B. But if you want to save money, you go here or here. This is similar to that other chart I showed. This is Medicare, 10% of the people, 58% of the dollars. And geographically, there's a lot of distribution about how much they spend per Medicare beneficiary across the country. It's a little bit old, but it hasn't changed that much. I want to come back to this so briefly. New study just came out, showed that Medicare spending differences geographically is driven by utilization. Atul Gawande wrote an article about this. What just came to light is Medicare, it's utilization driving price differences, spending differences. In private health insurance for employers, it's price differences. Who pays for Medicare? Just to recognize, Medicare doesn't cover 100% of health services. It's about half. This number is a little bit old, but Medicare pays for about half of all that's spent. Third-party payments, whether it's your retiree health benefits or VA or somebody else pays for about another 1/4. And then what the beneficiaries pay in their premiums and out-of-pocket is about another 1/4. Number of people, what I had up here before, this just shows the enrollment growth, the new enrollees in Medicare, and this is just the baby boomers heading into Medicare. The growth in Medicare spending. This is, the blue line is total, the red is per enrollee. Up and down a little bit. It's been dropping pretty significantly, up a little bit the last year. This is 2006. Anybody want to take a guess at what happened in 2006, which I told you before?
Part D.
Part D happened, that's right. This is when they put it into drug benefits. So year-over-year spending went up, but then went down again. There's been a lot of controversies of whether better coverage for prescription drugs causes savings in parts A and B. We can talk more about that if you want. But the thing to note is how the growth rate has been dropping pretty significantly if you take out that jump sort of since the early 2000s, or at least particularly since 2005. This is an absolute dollar chart. This shows healthcare spending total and per capita. This is the total, see, about $3 trillion, or 3 million, for you Austin Powers fans. And this over here is per capita. The interesting thing I put in here is back going to the 1960s, everybody was pulling their hair out about the percentage of GDP that was going to healthcare. Unsustainable, it's at 6%, it's at 8%, it's at 10%, it's at 12%, it's at 15%. Oh my God, we're going to crash. For like the last 5 years, it's been about 17.3, 73, 74, 7.3, 7.5, went up a little bit last year. It's been relatively stable. Part of that is because what happens to the economy goes up and down, and healthcare spending growth slowed. The percentage of GDP stays relatively the same. This is a chart, and I apologize, I couldn't find 14 numbers, but this shows, for Medicare at least, the absolute dollar amount has kind of leveled off per person. Private insurance has gone up a little bit. Both these did tick up a little bit last year. Why is healthcare spending slowed? This has been the Healthcare Economist Full or Overemployment Act for the last 4 or 5 years. This is a CBO study, 2013. What I just want to show is they found that overall spending between 0 and 05 and 07 and 10, it dropped by, the growth rate went from 7.1 to 3.8%, decrease of about 3.2% year over year. Does that make sense? So it's a percentage of the percentage. But what the study found was what they couldn't explain was 2.4% of that, or about 2/3 of the growth. Was there a question? Somebody? Just scratch your head? Okay, I can relate. This is another sort of real per capita spending. It went up and down, and looked at the recession. Everybody said, oh, it was the recession, it was a recession. That was a chunk of it. What people found is actually the slowdown started in 2005. It's just a blow up of that, showing where the recession is, income effects, some other things. And the actual growth rate, you can see, really was dropping pretty significantly. Let's look a little deeper. Medicare Trust Fund solvency. I couldn't find the original for this. So this bar here is 2015. It's 15 years. It went basically in 14 and 15. The projected insolvency year was 2030. But why would it go like, man, from 4 years in 97 to 10 to 16 to 25 to 28 years? What do you think was going on? What are one of the things? Let me just back a slide that can affect sort of the solvency of the trust fund.
The baby boomers hit their peak earning years.
Yeah, so that would cause what to happen?
More FICA taxes to go into the trust fund.
So the increased revenue. I skipped over it, but in '97 there was the BBA, the budget Balanced Budget Act. Thank you, Barry. Of '97, they keep changing the name and adding years. And it had all sorts of Medicare cuts to spending, and that drove up the solvency projections. Same thing happened with the ACA. Went from 2010, went from 8 years to 19 years and back down again. The president's budget proposal this year had all sorts of proposed cuts to Medicare, and some of them for the effect of trust fund. It had some text about if all this stuff happened, we projected to extend the trust fund solvency by like another 11 years. So all these projections about, oh, the trust fund's going insolvent. It's only going insolvent if nothing changes, and Congress passes legislation all the time.
You go to 97, 98, where it's like 5 years, 4 years.
Yeah.
The Clinton administration was so concerned about that we had to send across the street to the White House monthly reports on the Part A trust fund. That's how concerned they were that it was going to go into deficit during their tenure. So, which is probably overreacting because, as Mike's chart shows, it has an interesting history over time.
Again, a lot of this up and down, a lot of the ups have been related to legislation because they're just, all these trust fund assumptions are that nothing changes. Changes making spending projections, right? Now this is one of my favorite stupid slides because the middle bullet, first bullet, is just so inane. The more things stay the same, the more they stay the same, right? A lot of the budget projections and modeling is based upon assumptions of no legislation, no anything, nothing changes. It's a very simple way to model things. The reality in healthcare is the more things change, the harder it is to project or predict or model. And particularly when you're starting with a new program, Medicare Part D in 2006. there was a little piece of legislation called the ACA that changed a whole lot of things. And modeling and projecting what was going to happen with that, or even just straight Medicare changes. These are changing baselines for what Medicare spending per capita was going to be like. This is the baseline from August 2000. Basically, each of these lines is another year. This is 2006. So for 2014, it was projected in 2006 that Medicare spending was going to be about $14,000 per person. Almost every year, that baseline, boop, 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 kept dropping. So that the 2014 baseline, which is this dark line, it's now down to $11,000. So it's like a $4,000 difference here in just projection. Some of that's related to legislation, but some of that's just like the projections were wrong. And not because anybody was a bad economist, it's just, it's hard to predict changing worlds. This is a similar one for Medicare Part D. This is the original scoring in 2006 for the Medicare prescription drug benefit. 06, 07, 08, 09, 010, 11, 12, 13, 14, it just keeps the projection, the baseline keeps coming down and down and down. This is the first year that it's sort of gone up a little bit.